When state psychiatric hospitals closed in the 1970s, the seriously mentally ill were left with nowhere to turn, and prisons became the new asylums.
People know very little about the fact that we are treating thousands of persons in our prison population with serious mental illness, and they are a population that is at risk not only in the institutions, but when they leave prison as well. According to the federal report, the number one cause of death among inmates in local jails is suicide. Among state prisons, it is in the top 5, and it's not just suicide. Back in 2006, a study by the Bureau of Justice Statistics found that over half of all inmates have mental health issues. By and large, these people are not criminals. They are suffering from severe mental illnesses, but when they act out, they end up in jails because it is the only place that will take them. Fewer than 55,000 Americans currently receive treatment in psychiatric hospitals. Meanwhile, almost 10 times that number, nearly 500,000 mentally ill men and women, are serving time in U.S. jails and prisons. Sheriffs and prison wardens become the unexpected and often ill-equipped caretakers of this growing population, as a rising number of mentally ill inmates show no sign of abating. Those working inside our nation's prisons are struggling with a system designed for security, not treatment. Correction officers have the responsibility of not only securing inmates, but also working with mental health staff to identify and manage disturbed prisoners. When a mentally ill inmate is eventually released back into the community, they are released with a limited amount of medication, little preparation, and sometimes no family or support structure. Any person who leaves prison without a good support system will have a very difficult time staying out of prison. And if you are mentally ill, it compounds the possibilities of you being successful in the community. Mental health treatment can help some prisoners recover from their illness, and for many others it can alleviate its painful symptoms, prevent deterioration, and protect them from suicide. By helping individual prisoners regain their mental health, it promotes safety and order within the prison itself. Facts are facts. When it comes to mental illness within our criminal justice system, the facts tell us a damning story. Proposition 47 on the November 4th ballot is an important step in that process. It can help rebuild our mental health and community infrastructure by reducing waste in the very place that has swallowed up all of those resources over the years. From the 1950s to the 1970s, California passed laws to move responsibility for mental health care from large state institutions to a model of local community-based care. But there never was a follow-through to ensure that infrastructure was created and supported. As local and state leaders battle over the budget priorities, mental health beds vanished and nothing materialized at the local level. Earlier this year, Stanford Law School reported the number of mentally ill people in California prisons doubled from 2000 to 2014. Currently, 45% of prisoners have been treated for mental illness within the past year. The study also echoed findings by the U.S. Justice Department that mentally ill inmates in state prisons serve 15 months longer than other inmates on average. Such inmates are also struck without treatment in cycles of crime and incarceration. A study in Los Angeles County found that 90% of jail inmates who had been incarcerated 2 or more times had serious mental health problems. All this adds up to is an incredibly expensive and inefficient approach to both public safety and public health. So how did we arrive at this crisis? By failing to invest in local treatment and recovery options, it is no surprise that people with mental health needs have ended up in our jails, courts, and prisons. And while there needs to be accountability for crimes, warehousing mentally ill people in our prisons, forcing them to live in crowded, violent, and solitary conditions does not address the underlying factors of their behavior. We cannot change the troubling facts about California's recent approach to mental health, but we can change course to create a more humane, effective justice system Passing Proposition 47 is an important step in that direction. Mindful of budget constraints and little public support for investment in the treatment of prisoners, elected officials have been reluctant to provide the funds and leadership needed to ensure prisoners have sufficient mental health resources. Overburdened staff are hard-pressed to respond even to psychiatric emergencies, much less to promote recovery from serious mental illness and enhancement of coping skills. Although there are many conscientious and committed mental health professionals working in corrections, they face many challenges meeting the needs of their patients. The gains of mental health staffing programs and physical resources that have been made in recent years have since been swamped by the rising number of prisoners with serious mental illnesses. These mental health professionals have insurmountable challenges to meet, impossibly large caseloads, and physically unpleasant facilities that they work in. Prison mental health services are all too frequently inadequate, crippled by the understaffing, insufficient facilities, and limited programs. Many seriously ill prisoners receive little to no meaningful treatment. Prisons constitute a high-risk setting for suicide. Despite the complex causes of prison suicide, inmates with mental illness and poor psychological coping mechanisms are more likely to commit suicide than otherwise mentally stable inmates. The high prevalence of mental illness among prisoners, as well as the stresses associated with imprisonment and the criminal justice system, further increases the risk of suicide. The implementation of effective mental health strategies is an essential component of prison suicide prevention programs. Pharmaceutical costs are a significant component of the overall mental health care costs in corrections, and generally increase about 15 to 20% annually. As a result, prescription drugs often become the target of aggressive cost-cutting by private healthcare providers. Inmates being released from prison are particularly vulnerable to serious relapse from the effects of drugs and alcohol within the first month of release. While in prison, most inmates receive minimal medical treatment for substance abuse, except for detoxification. Long-term relapse prevention is limited to self-help groups like AA and therapeutic communities. The United States has the highest rate of adult incarceration among the developed countries, with 2.2 million currently in jails and prisons. Those with mental disorders have been increasingly incarcerated during the past 3 decades, probably as a result of the deinstitutionalization of state mental health systems. Correctional institutions have become the de facto state hospitals, and there are more seriously and persistently mentally ill in prisons than in all state hospitals in the United States. In conclusion, innovative and comprehensive treatment programs in prisons, coupled with state-of-the-art diversionary measures for the mentally ill prisoners, must be pursued to prevent a high rate of recidivism and morbidity of prisoners and to facilitate their adjustment back into the community. Unfortunately, prisons are ill-equipped to respond to the needs of the growing population of the mentally ill. We cannot change these troubling facts that plague our criminal justice system, but we can create a more humane and effective system to take its place.